Let's talk a little bit about how terminology has changed. It's always very interesting. Medical terminology often changes over time.
Yes.
And there has been historically terminology used with organ transplants that really kind of put people off and made them more wary about donating and becoming a
Yes.
donor. How has that terminology changed over
Well, I
the
think
years?
that we know the power that words really do have, especially for donor families. When you talk about harvesting organs versus recovering organs,
It's almost kind of offensive,
yeah,
harvesting
it
organs.
can conjure up really bad images for those
And
families.
also, you almost feel like the body is being almost disrespected when you
Yes.
talk about harvesting plants.
Right.
I mean, this was a person that we're talking
Right,
about.
and
so
I mentioned how we treat donors with the utmost respect and care because they are heroes. A donor will save someone's life, and you can't put a price tag on that, and you certainly don't want to put a bad image on that. So we are careful about the way we talk about organ and tissue donation. We want people to realize the power the gift of life really has.
I think that it's really amazing because I work at a medical school where the medical students talk about people who donate their bodies, because medical students, in order to become
Right.
physicians, need to be able to dissect bodies and learn about the human body. And they talk about the people who do that as heroes. I mean, every year when they go to the services to commemorate them, they truly do talk about them as heroes, that physicians would not be able to learn their craft if it weren't for that kind of generosity. And clearly organ donation is the exact same thing.
It is a very compassionate gift, and the people who are donors absolutely are heroes to the recipients, to the recipients' families, to people like me who work in this field every day.
Yeah, to know that a part of your body lives on and is either saving someone else's life or enhancing their life.
It's a
is
great lasting
remarkable.
legacy, a last gift to give, and I mentioned earlier, donor families feel so much pride, and it really helps with their grieving process to know that their loved one is living on, and then you always have that opportunity to potentially communicate with your recipient as a donor family member and to even go on to meet one another.
Now, is that common that recipients actually meet the donor?
It is becoming more common. Lifeline of Ohio facilitates those meetings, so the parties both.
And the donor family, I should say. In most cases, it's the donor family, not necessarily, because most donors are not living donors.
We're talking about deceased donation. Lifeline of Ohio coordinates deceased donation. Living donation happens at a transplant center. So we are talking about patients that become donors after death. So yes, those families then communicate with their loved ones, transplant recipients, the people who receive their organs, and then potentially go on to meet one another. But it takes a series of writing letters, and there's no time frame around that. People can write as soon as they want, or some people need a little time to wait to find the right words to say thank you as a recipient, or to be able to tell their loved one's story if they're the donor family member. And then after the series of letters has been exchanged and they both express the mutual desire to meet, we can help coordinate that meeting. And we're doing about 20 or so a year, which is increasing, but certainly we love to be doing
In
that.
Ohio, 20 more a year in Ohio.
We actually serve just a portion of our state. We have about 40 counties in Ohio, and there are 3 other organizations like ours, one in Cincinnati, one in Cleveland, and one in Dayton that serves the Toledo area as well. So we're talking about just our service area of 40 counties. So about 20 meetings a year is really not a whole lot, but it is a number that's increasing. Again, though, we've only had, last year was a historical year for donation in our service area for organ donation, and we had 107 organ donors.
That's really good to hear. So most people then ultimately decide not to meet the donor family
Well, I
and the
wouldn't
recipient.
say that necessarily. Some families feel that just communicating through the letters and saying thank you and sharing their loved one's story is enough. And some families really feel compelled to meet. So we're seeing that number of meetings increase, but it's whatever's right for each family and for each situation.
Yeah, historically that was kind of discouraged because doctors were a little bit worried that donor families might get too attached to the recipient.
Right,
The
or
recipient
vice
would be very
versa.
uncomfortable.
And
but-
donation is an anonymous process. It's confidential. So
both
certainly,
clearly consent to this.
Yes.
At the meetings, both must consent.
and it must be on their own time, in own terms. We don't want either party to feel persuaded to meet or uncomfortable when they do meet. So we let them sort of come to that decision on their own, but we're happy to help them through that process.
Tell us a little bit about the drugs that people have to take. If they're the recipient, they have to take drugs to prevent rejection of the organ, because unless there is an absolutely perfect match, which only really happens if you have an identical twin being a donor, you need to take medication to prevent rejection of the organ or the tissue. Isn't that right?
I believe so. Lifeline of Ohio, as I mentioned just a few moments ago, deals with deceased donation. So once the organ arrives at the transplant center to be transplanted into the patient waiting, that's sort of where our job ends. Of course, we support our donor families, but Lifeline of Ohio doesn't do anything that's really related to the transplant process beyond those operating room doors, if you will. So I don't have a lot of knowledge about transplant recipients and exactly what they do go through, except for those people that I work with as volunteers at Lifeline of Ohio, the recipients who feel like they want to pay it forward and give back and say thank you, and that's their way of doing so, helping us to educate the public and sharing their personal stories. So they've told me they take lots of medications, but it's a little price to pay for being a lot.
We'll talk about that more on the next show, because we're going to do a second part on organ donation. What exactly is the relationship between UNOS, the national bank that keeps track of organs, and Lifeline of Ohio? How do you interface with them?
Well, the United Network for Organ Sharing holds that national transplant waiting list as a contracted government agency under the Department of Health and Human Services. Lifeline of Ohio is an organ procurement organization, and while we're not a government agency, we certainly follow the Federal Drug Administration guidelines and the Center for Medicare and Medicaid Services guidelines as well. So we are feeding the information, the donor information that we receive, into that computer database that we've talked about for the United Network for Organ Sharing that generates that recipient list. So it's a partnership, but we are not a government agency.
And it is illegal in the U.S. to sell organs, isn't it?
Yes, we see that on TV all the time. You wake up in a bathtub full of ice, your kidney's been removed, and it's being sold on the black market. There is no black market for organ donation in the United States. It's illegal. It does happen in other countries. It's something that we're seeing an increased transplant tourism is what it's being called, but it's not supposed to happen here in the United States, and I've never heard of any cases.
And it is horrifying even to hear your description of some of the things that we've seen on television. It's horrifying even to hear the description, let alone.
We just have to remember it's for entertainment purposes only.
Yeah, and that doesn't happen. That is why we have a very strict federal laws governing this, and we really have a watchdog group that really coordinates how these organs are used.
And that's why it's so important that it's centralized, because then it's a fair and equitable process, and the rich and famous, they don't have a more of an advantage over someone like me. I'm not rich and famous, so it's really fair, and that's the way to ensure that.
And as you said before, it's only because we hear about the rich and famous, mainly to hear more publicity about organ donation, and it doesn't happen.
It's sort of a double-edged sword. It feeds that myth, but at the same time, it brings it to the front of the news pages and gets people talking about it.
Thanks so much. I want to thank our guest, Heather Blausey. Join us next week when we continue our conversation about organ donation and talk with a living organ donor and a liver transplant recipient about their personal experiences. For upcoming episodes, viewer feedback, and links to important information on health, log on to our website at the address that appears on your screen. Thanks for watching Health Vision, a production of the WOUB Center for Public Media.